So next we have Dr. Ambika Shetty, who is the Medical Director at the Geethanjali Eye and ENT Hospital, Trivandrum. Other than ophthalmologist, she is a person who practices yoga and mindfulness a lot. So it is actually apt to hear from her how to improve your surgical performances by practicing yoga and mindfulness. Over to you, Dr. Ambika.
Thank you, Dr. Raki. A warm good morning to all of you. So, I'm Dr. Ambika. I'll be speaking about how you can enhance your surgical performance. You can improve your focus, you can improve your clarity and make better decisions. So, we know that the ophthalmic surgeon has a very high mental load. There is a constant visual concentration that you need to concentrate on your surgeries, and there is a high emotional demand. So most of our surgeries are under local anesthesia. Patient has lot of comorbidities. Patient is looking at you for emotional support. So along with your surgery, you're supposed to reassure and be compassionate also to the patient while you're operating. And also, most of us are operating high volumes. We are doing so many surgeries, and in the back of our mind we have, oh, now OPD patients are waiting, something else is happening. All these things are running in the background. So there is a possibility of fatigue and attention drift as well. So why does it matter? Why should you become mindful? So we know that microscopic surgery needs unbroken precision. It's a very precise procedure that we need to do. So distraction will affect your outcome. So that is why mindfulness will improve your focus and also your composure. It's always better to be a calm surgeon as compared to an anxious or a tense surgeon. So coming to the difference between a reaction and a response. A reaction is something which is instant. It comes from the unconscious mind, and it is does not consider the long-term effects. Sometimes the reaction may be okay, but sometimes the outcome may not be good in the long term, and also it may have some kind of an adverse impact to the people around you. If you look at response is slow. It takes both it is based both from the conscious and the unconscious mind, and it is the decision comes from the prefrontal cortex. It takes into account the long-term effect. So definitely the response will be more compassionate for the people around you. So what is a fight or flight response? It is basically it is a physiological reaction to a perceived threat. So olden days, when somebody was in the forest and there is a perceived danger, there is a fight or flight reaction response. So we know that the sympathetic nervous system gets stimulated. The person can have dilated pupils, increased heart rate, flushed skin, and also a rapid breathing, which actually prepares the person for intense physical activity, and it can also cause trembling. So what is mindfulness? Mindfulness means paying attention to the present and also being in a non-judgmental way. So it involves bringing awareness and acceptance of each moment. So in the operation room, when can you be mindful? So first of all, before starting your surgeries, you can actually do a grounding breath for yourself. During the procedure, pay attention to your posture and also try to practice some micro pauses in between. And after the surgery, try to reflect on your day without indulging much into self-criticism. What is it that you learned on that particular day? So as I said, during procedures, take one deep breath before each key step. So say if you're a cataract surgeon, capsulorhexis, hydrodissection, nucleus fragmentation. These are your key steps. So take a little bit of a deep breath and bring your awareness back on your breath so that your mind stops wandering. Scan for any muscle tension. Sometimes during the end of the day you notice that your back muscles, your neck muscles become stiff. So during the procedure itself, you try to also see if you're holding some muscles in a very tense manner, and every 10 to 15 minutes in your OR, try to reset yourself. So what about your team? So we all know that surgery is not a one-man show. It is always a team game. So before you start your procedure, you speak to your team members. You say, okay, what is this list I have today? Are there any special cases? What are the things that we need to be prepared for? If there are highly complicated cases, prepare the team for any situation, difficult situation that may come up. And also, you need to understand your competence of your teammates. If there is a unscrubbed nurse who is who is in a beginning stage, you need to be a little more cautious how you need to support that particular individual. So coming to how can you practice mindfulness. So one of the practices you can think of is pranayama. It basically means a regulating of the breath. There are various practices by which you can start working on your breath. So it rewires your nervous system, and it brings about a balance between your parasympathetic and your sympathetic nervous system. And also it can cause an increase in the parasympathetic dominance, because of which you will feel more calm and relaxed during your surgeries. So what are the benefits? Definitely there is a reduction in the perceived stress. Whenever there is a difficult situation, you will notice that the perception of the stress goes on reducing as you become more mindful. There is less burnout, more motor precision. There is better team cohesion, your team members will like you a little more. And also you realize that there is better memory and learning. The working memory will be much sharper. And studies have shown that there is reduced age-related grey matter loss in the cortex in long-term meditators. So also there is a stronger hippocampus which causes better cognition and memory. In my experience, I started yoga and meditation back in 2016, and I can experience a lot of joy and gratitude which lasts for me throughout the day. And also I feel it percolates to my patients as well, because I see a lot of them being grateful and walking out of the OP. Along with yoga, I'm also practicing Kalaripayattu. So one thing about Kalaripayattu, I would say, is it reduces fear in individuals, so it's very helpful. So how to start? You can go for physical classes, you can go for online tools, and most important is to practice every day, and also form support groups who can support you in your practice. So you remember that it is not something that it is not like, oh, now mindfulness is one more task. This is definitely a performance enhancing tool, and it will be very helpful for you in the long term as well. Thank you.
Thanks a lot, Dr. Ambika. One question to you. So, I'm a surgeon, and I just had a PCR on table, okay. So, I know the steps, what I should follow, but right now I am asking you, what should I do mentally first?
So, in this particular case, it looks like maybe you are not expecting PCR and it suddenly happened. So, first thing is you just step back, stop your surgery, take a deep breath, and then slowly analyze, okay, now that this has happened, what should be my next plan of action? And then about the people around you. So you have to think, how will I engage these people? Now, if you need to change your machine settings, how do I do that? You need to get new medication. You know all the steps, that's true. But yes, you have to step back, take a deep breath, analyze, and then go back. So that is the pause is very important.
So, what I usually face is, I might be doing this and I might start the recovery procedures like vitrectomy and everything. But back in my mind, I'll be like, how will I face the bystanders? What I am going to tell about the lens change? These things will keep on popping in my mind that I face difficulty in continuing the rest of the surgery. So what to do about that?
Yeah, so that means you have gone to the future. You're not there in the present. So it's always like recentering. You keep bringing your focus back on your breath, and you do what you need to do now. What you need to do later, you can do that later. So it's recentering.
Thank you.